Assalamualaikum warahmatullahi ta'ala wabarakatuh. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Wassalatu wassalamu ala ashrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Thank you for all of you who are attending this session. We have a session now with Datuk Dr. Rohaizat Haji Yun, Deputy Director General of Health, the Ministry of Health. We are so glad that he is here with us today and able to expound on our topic today. As we all know and are familiar with him, he is the man on the right hand of the Deputy of DG, Hisham, Datuk Tan Sri Hisham, who is always in the evenings spending his time with us during the press conference, updating us daily on the events that about COVID, the numbers and the figures. Datuk Rohaizat is actually a person who has got full knowledge of this COVID crisis that we are in. He has been there from the beginning till now. He obtained his master's in health planning and a PhD in public health, majoring in health financing, health economics and case mix. He has written more than 60 publications, more than 80 health-related presentations at national and international level. He has served the government for more than 33 years at various levels, and extensive experience in the Ministry of Health. He manages crisis and disasters. Currently, he is managing this current disaster of COVID-19. He has managed the influenza, the chemical pollution in Sungai Kim Kim. He's managed the fire in this hospital in Johor Bahru and the floods in Kuala Krai Hospital. If we all remember, these have all been very disastrous situations, and we needed someone with the capabilities of dealing with them. He has been a major contributor and officer in charge in health planning, midterm review of the 7th Malaysia Plan, development of the 8th, 9th and 11th Malaysia Plan. He's participated in numerous national healthcare financing, healthcare reform and national health plans. One of them was implementation of My Salam in MOH hospitals. He has done healthcare delivery, hospital reform. He's corporatized 14 general hospitals. He has done work in hospital and health services management. And so he is ideally suited today to talk to us about this topic. Datuk Rohaizat, the script is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much, Yang Berusaha Dr. Jeffrey Abu Hassan, Presiden Persatuan Perubatan Islam Malaysia, IMAM, distinguished guest speakers, IMAM Excos, IMAM Symposium Committee members, and all participants and viewers of this symposium. Alhamdulillah, it is with His great blessing that all of us can meet today for this symposium, albeit by virtual means through this webinar. It is an honor for me to be invited to present my lecture today.
So this is the flow of my presentation. I will very briefly mention about the novel coronavirus, COVID-19, and what is our story in Malaysia, how did we do, and what is the role of CPRC Hospital Services. As I'm the Deputy DG, Deputy Director General of the Medical of the Hospital Services, I will focus more on item number 4 and illustrate what is our success and how did we do leadership in crisis, the strategic plan, and share some of the success story. I think all of you know that there are 4 situations. Situation number 1, whereby the number of cases are very high, and after that, after some time, cases are coming down. And situation number 2, cases very low, and then it's going up and slowly down. And also third situation whereby initially no case, it going up, come down and coming back again. But it's also, I think you know, the fourth situation in one particular country or several countries that cases from zero coming up and coming up and up and up and up and up. As for Malaysia, I would think that we are somewhere between situation number 2, basically situation between number 2 and number 3. Yeah, and I think all of you remember what happened. When on the 3rd of January, on the 31st December, 31st December 2019, 31st December 2019, when the WHO China was informed that of the pneumonia of unknown cause was identified in Wuhan city, Hubei. And after that, you see, that was last year. And since that, the 3rd week of January, massive public health intervention were done, and Wuhan, the epicenter of the outbreak, has been locked down. Since 23rd, and with 16 neighboring cities in Hubei provinces included behind the cordon, and it become a national issue at that time. And after that, you can see what happened last year, December 2019, and then last year, and then January, and then after that, in Malaysia, what happened? We got the imported cases in January, and after that, February, first local case. January, import, and then February, first local case. And what happened? See, what happened in Malaysia during that period? That is the shifting of the government. That is the challenge that we face. The shifting of the government, because of the government at that time, under the Pakatan Harapan, lost the majority. And we were lucky at that time. We were quite lucky because during that period, the previous government already decided that only Prime Minister can make the statement, or in absence will be Deputy Prime Minister, number 3, the Minister of Health, or number 4, DG of Health. During that period of about 11 days, you can see here, on 11 days, 24th of January, the first detected positive in Malaysia, and then we have absence of cases for 11 days, and after that, second wave was 26th February. You can still look at your slide, 26th of February, the second wave, and this is the one that I mentioned to you. You can look at down there. Malaysia is without a cabinet minister from 25th February until 9 March. So the health system, basically the COVID-19 has to be the only person as spokesperson at that time available was only DG of Health, because we do not have the Prime Minister. We have one Prime Minister, but it is just caretaker, no Deputy Prime Minister, no Health Minister. So that was the pain that been shouldered by the Ministry of Health for almost 2 weeks. And after that, when the new cabinet was formed, on the 10th of March, the new cabinet minister was formed, and the new cabinet only has about 8 days. On the 18th March, because of the second wave, cases were very high. So on 8 days after the new cabinet was formed, Ministry of Health successfully convened the new cabinet ministers, and then they all agreed that the first lockdown was started on 18 March. And after that, we gradually from MCO reduced to CMCO and so on. And on the 10th of June, Malaysia was at the recovery MCO. And after that, now new clusters are coming out, and then new cases also emerge. So we have to have other strategies. Next. So if you can see this slide from your look at this side, whereby on the 27th of February, that was the local cases, and then on the 11th March was the new wave, the second wave, And you can see that phase 1 MCO, phase 2 MCO, and so on, the cases was increasing and then coming down and then almost go down, but it did not disappear. And then it went up again. And we have several clusters like cluster Sibaganga, cluster Tawau, and recently, very recent is cluster Tratai. Cluster Tratai, you can see on your extreme side. Cluster Tratai is basically the industry, whereby we have a lot of cases from this company. Next. And this is an illustration, and then it is much easier to look at it. Pre-pandemic, you can see that. And then you can, after that, the first pandemic, and then case return to baseline. After that, second wave, and then after that, case coming down, and then now it's coming up on our third wave. And there are so many clusters appearing, and we are now struggling and then fighting to reduce this pandemic. Yeah. Next. JP Morgan and MIA and Imperial College has predicted that our cases will be increasing. Next, if you look at the summary on your right hand side, JP Morgan predicted on mid-April, Malaysia will have 6,300 cases, and MIA predicted on 24th of April, Malaysia is expected will have of 5,000 cases, and it will increase up to almost 8,557. But you know what happened when MIA predicted that, when JP Morgan predicted that, if Malaysia really will get 6,300 cases, and all of you know that, more than 60%, maybe 70% and 80% are maybe asymptomatic or mild, but 30% will be symptomatic, at least 3 to 4% will need ventilators. So whether, number one, Malaysia will have 6,300 beds, whether Malaysia will have at that time enough ventilators or not, whether we have ICU or not, and then whether we can keep patient 6,300 for 14 days or not. So this was the challenge at that time. So what I want to share with you, during that time, we already started our preparedness, because we prepare for the worst. And now, Imperial College predicted that from 10th of November, Malaysia will get 4,413 cases daily. But in reality, all the three predictions did not materialize. Why? Because we strive, we mobilize all the resources. We want to make sure that our public health has the capacity to do the contact tracing, to treat the patient, and all work together with all other agencies and implement what we call it whole of society approach and whole of government approach. And you can see on your right hand side the actual the cases at that time were not 6,003, it were only 4,009, and then down there at that time 12th of April it was 4,006, and on 10th of November we only had new cases daily 869. I think more public health measures will be intensified from today onward. Yeah, it was started even since a few months ago, and we do the modeling. We do the modeling, and this modeling based on the SEIR model, and you can see that we started with 2.2 R0, 2.2 R0, but you can see that our R0 we did not get our cases 2.2, and our R0 actually you can see even if you put at 1.5 R0 and then look at the red one, the real thing that actual thing that we are now at between 1.2 to 0.9. It is not even more than 1.5. Of course, it is very lower than 2.2 R0. So every day we monitor this weekly, daily, and we intensify our public health activities. Next, and lot of debate talking about a lockdown. You can see there is no right and wrong answer. Everybody all over the world, they are learning. There are countries that, like this one, Sweden and Italy, although they have a lot of cases, there's no lockdown. And then look at another extreme side. Next. And look at this. Taiwan and New Zealand, and Korea, even they have very few cases and they did lockdown. In Auckland, for example, Auckland got 4 cases after 103 days without any cases, and the 4 cases emerged, they locked down. And Korea, and it successfully managed to reduce the transmission of the diseases. So there is no right and wrong answer for that. But I will share with you the meaning of lockdown in Malaysia. Next. And what are the Malaysia's approach to COVID-19? You can look at on your left-hand side, we do the surveillance and public intervention, we enhance our diagnostic testing, and then we have moment control order, and we do the evidence-based approach, risk communication, we isolate and treat. Maybe if I focus on public health intervention, we do community and entry point of the screening, and a mandatory quarantine for 14 days. We do active case detection and tracing, SARI and ELI surveillance, and we do pre-op surveillance, and then we all surveillance for new healthcare workers, and then also we do targeted approach of mass screening, targeted particularly to vulnerable group or high-risk group, targeted to certain localities, targeted to certain clusters, and then we do mass screening when we enhance the area that we lock down. And then we do the terminal cleaning, healthcare worker deployment, mental health assessment, develop SOPs, and also CAPP and DRPP. This is basically the community empowerment program. Next. This is some of the example. Malaysia closed the borders. We shut most business during lockdown. And then campus testing, on your right hand side, you can see we barricade the Selayang market traders. Next. And this is some of the public health measures that we do. Next. And people talk about testing. Yes, you can see Malaysia, we do 76.4 number of tests per 1,000 population. This is comparable with the number that been conducted by South Korea and Sweden. South Korea, Sweden, but it is higher than Japan and is higher than Thailand. But you can see in terms of positivity, Malaysia is only 2% positivity. South Korea 1%. But look at New Zealand or UK. UK performed 508.8 number of tests per 1,000 population, but the positivity is very, very high, 4%. And look at Sweden, 59.2, but the positivity is still very high. So when the positivity is very high, so they must do more testing to pick up more cases. If the positivity is low, maybe the testing may be reduced. But whatever it is, there is no right and wrong answer for that. It's based on the capacity of respective country, based on their resources and so on. In Malaysia, we do targeted and we do very focused testing. And some said that we did not use RTK antigen. It is wrong. And we are doing PCR as our gold standard, RT-PCR as our gold standard. We also do RTK antigen. So we do both because we want to do testing. We want to do it fast. We want to cover more areas. Next. And COVID-19 dichotomy, we have to balance between the economy and the public health. We are in shared struggle to protect both the life and the livelihood. This is very important. We have to balance between the two. Look at down there, the movement control order. This is led by the National Security Council. Number one, you can look at down there, the one I put in the red box. Lead agency, National Security Council, strict border control. And this is important for all of you to understand. We have 4 phases of MCO. Lockdown in Malaysia basically is divided into 4 types. Number one, enhanced lockdown. Enhanced lockdown. Initially, when we started on 18 March, we enhanced lockdown whole country. After that, we do enhanced lockdown specific areas. specific areas. That's number one. And number two, targeted EMCO, targeted enhanced lockdown. Meaning we do lockdown certain area, but we target, focus, it is more precise, targeted to the cluster. Enhanced is targeted to the high risk localities. This is targeted to specific clusters. Number two. Number three, when the cases are reducing from MCO, we move to CMCO. From MCO, we move to CMCO. Meaning, this during CMCO, the essential services, of course, still functioning, and then many economic activities are allowed to function. So it will not really jeopardize the economy of the country, yeah. Except during CMCO, some of the social sectors are closed, like education, sport, and so on. And then another one is recovery MCO. Some states in Malaysia are now at the recovery MCO, whereby economic activities, the businesses, social, education sector reopen in phases. So a lot of people talk about MCO, but they got wrong perception. We are not basically implementing it like now. We are not implementing like what we did before during 18 March 2020. In 18 March 2020, we locked down the whole country, and then what we call it MCO. But after that, from MCO, we move to CMCO, and we move to RMCO. Okay, next. This is then illustration for you. Maybe you can see better picture. MCO phase 1, and then MCO phase 2, MCO phase 3, MCO phase 4. We did it very well. And down there you can see the implementation nationwide. Border management, you can see that. Closed border. Down there you can see closed state border during that time. And then down there, essential movement during MCO, phase 1, phase 2, phase 3, only essential movement only. And then what happened? Only one person in the vehicle. And then after that, when we move to phase 3, MCO, 2% in the vehicle. And then curfew during that time, 8 p.m. This is MCO phase 1, phase 2, and phase 3. But when it goes to MCO phase 4, you can see essential services reopen. And then interstate permission is allowed. And after that, the cases went down. And then one cases went down from MCO, we move to CMCO. Interstate transport is allowed, you can see that. And then interstate allowed, and then some interstate we give then with the permission to move. And then you can go down there, the businesses, look at down there. The last row. During phase 1, phase 2, phase 3, MCO, only essential services, 22 essential services allowed. And then during MCO phase 3, we added another 2. And then when MCO phase 4, another one we added. But when it comes to CMCO, more and more essential services reopen. And then when RMCO, almost all sectors are allowed. So it is basically the baby step. And then now some states, some centers, some district, we implement the last one, EMCO. So you can see some variation. Next. So how did we do? Coordinated response. You can see the National Security Council, followed by National CPRC. Every day, we have the National CPRC meeting with NMOH, and then below that, we have hospital CPRC, and then below hospital, we have the state and hospital operation room. You can see on your left-hand side, it is National Security Council. This is basically for the national. It covers all ministries. And then this on my right-hand side is the National CPRC. This is related to hospital. Yeah. And then National CPRC related to health services, and then hospital services, and state related to health also. Next. And what did we do with regard to hospital services? What did we do? There are 4 main strategies. Number 1, the clinical care for COVID patients should not be affected. So what we want to do? We improve the care, reduce the mortality. Number 2, strategy number 2, protect healthcare workers. This is our main focus. Number 3, service continuity. The treatment for non-COVID patients will not be jeopardized. And number 4, we must make sure that we help increase the cure rate and then reduce the mortality, hence we can increase further our health industry development, we can boost the economy. Go back to strategy number 1, clinical care for COVID patient will be enhanced. What did we do? We increase the capacity of the hospital, we increase the medical equipment, we buy the PPE, we improve the lab support, we improve the infection control and so on. And then to protect healthcare workers, number 2, we develop the infection prevention control. We have the OSH, of occupational safety and health management. We have specific quarantine centers for healthcare workers. We have healthcare workers work as a team. And then number 4, we care with the non-COVID patient, and then because we are now treating more and more COVID cases, non-COVID we outsource non-COVID cases to private hospital. And also number 4, always we enhance the economy. We open health tourism with strict SOP. We increase public-private partnership via outsourcing the lab services to private. We do outsourcing the health, the lab, and also the non-COVID cases, the surgery, and also the operation to private hospital. Next. And how did we do it? I mentioned to you, we can see from alert phase to early containment, late containment, and recovery. Earlier, we only have 56 hospitals, screening hospital, 26 treating hospital. This was 16 January. After the Wuhan announced last December, 16 January, we already got this. 56 hospital screening, 26 treating hospital. We have 1,661 hospital bed, ICU 9, and then total lab in the government were 6, and the capacity 832 tests. But now we can see screening hospital from 56 became 122 hospital capable to do screening. From 26 hospital now increased to 45. Hospital bed increased to 506. ICU increased to 502, 501, and ventilators, and now we have increased to 1,553. Over and above that, we have developed low risk treating and quarantine center. This is low risk. This is another hospital, but treating only low risk, and the capacity is 12,769. You can see that I have 5,000 bed plus 12,000 additional beds. So altogether, we have about almost 17,000 and almost 18,000 beds ready. And how about the lab? From 6, now we have 62 lab, and the capacity now is almost 60,000 tests per day. Next. So what are our secrets in hospital management? There are 4 main secrets. Number 1, solid governance. Number 2, leadership in crisis, evidence-based as well as value-based. And number 4, strategic planning. And number 1, working together. This is very, very vital. You can look at this the governance working together. We work together with armed forces, non-governmental organization, private health sector, universities, the Royal Malaysia Police, and with National Disaster Agency Malaysia NADMA, with the Fire Brigade and National Security Council work as a team. Next. And leadership in crisis and anchor in the storm. At that time, it was not really storm. I think I will consider that as tsunami, a real tsunami. But you know what happened in Malaysia? You can see back that slide. You can see that even the Agong, the King, the Prime Minister, the Health Minister, the Permanent Secretary, and DG work together as a team. Yeah, and this is what I said: leadership in crisis. Next, and as I mentioned to you earlier, 11 days. Yeah, 11 days Malaysia was without cabinet minister, and during 11 days, DG of Health take charge with regard to COVID-19. And again, leadership in crisis, particularly in hospital management. I think you can see that we have about six strategies, 6 activities. Number 1, doing the impossible. I will explain to you together. Together, everyone achieve more, work as a team. Being the influencer, as I told you, 10 days without the cabinet minister. and after the new cabinet was formed, and 8 days later, we managed to influence the new government implement MCO. Number 4, competing for the less. Number 5, fostering trust amid chaos and service above self. Let's see. We can go one by one, and this is doing the impossible. MCO Act 342. We never implement this act. So this is the first time. We start implementing this act this year. And then we manage the Sri Petaling cluster. You see this is the second wave. The huge cluster is the cluster Sri Petaling. So we managed to flatten it by early July 2020. And by doing this, MCO will reduces the stress to the hospital side. But look at on your left hand side. Hand side is what I call it pusat quarantine and rawatan COVID. This is the low risk hospital. And then how long did we take? If Wuhan took 10 days to build hospital, we took only 3 days to build the hospital. You can see that on the right hand side. This is what we call it MAEP, short form MAEP hospital, and we did it in 3 days. And down there you can see we have the makeshift hospital. We have the makeshift hospital, and we have the field hospital. Field hospital, we convert the one of the stadium to be hospital, and we makeshift. We change the certain places to be hospital. And you can see that the photo at the middle, Tan Sri DG and me, we have dialogue with the tablet group. We had dialogue with tablet group to persuade them to come for testing. Yeah, next. So this is what I said, doing the impossible. And together, this is another secret. Together, everyone, we achieve more as a team. You can see that on your left, on left hand side, even the King and the Prime Minister came and visited our center. Yeah, the Prime Minister, the King did not visit even Health Minister office, but they visit our CPRC, our what we call our backliners office, where we all do the strategy, and we work with other ministries. And down there you can see we work together and do lockdown at many of the premises. Next. So, and then we compete for the less. You can see on your left hand side, coronavirus, global need for PP like Wild West. So Malaysia sourcing N95 alternative after US block export. So you can see that everybody looking for PPE. We are buying that. And then so you can see that on the other side, on right hand side, coronavirus buying PPE online. It is like Wild West. Yeah, this is how buying that. And then doctors PPE shortage. This is what happened. Supply issues. Doctor proposed national stockpile centralized for better distribution. So what we did, we are competing for the less. We prepare all out for the hospital need. This was basically very, very stressful during the early May 2020. April and May, but now we have enough supply. Next. And this is why I want to mention to you earlier, fostering trust and amid chaos. We have meeting with the King, with the Prime Minister, and we have daily press conference to inform to the public and to inform them to develop the confidence. We have high cure rate, low mortality rate. We want to enhance the trust to MOH. We have educate and train healthcare personnel, and we work 24/7. We have adequate bed, ICU, ventilators, PPE, drug, and so on. Next. And service above self, if you can look at over there, our staff doing 24/7, and look at down there, you can see someone, because they are working, they are very thirsty, and somebody supply the water for them and the staff, and another staff sitting tiring. And look at online side, this is my team, and you can see my attire. That is during the Hari Raya. So there is no Raya for all of our staff. Yeah, every day is a working day, 24/7. Next. And strategic planning, anchor the storm, very important. Strategic communication, good governance, medical resources, workforce, hospital operation, and data. All these are very, very important. Next. And this is the illustration, we have the dashboard. I told you, the Prime Minister, the King visited look at our dashboard. How did we do? We monitor every day. We monitor the bed, we monitor the cases, we monitor the PPE. This is what we do. Next. And again here, dashboard, all hospital, what is the bed like, how many cases, and so on. Next. And you can see this is every state. We have, you can see this map. This is PPE. Every state we monitor. We never ever allow any state that the supply of PPE less than 3 to 4 days. And then what happened? If the supply less than 3 to 4 days, there is no answer. There is no such thing that the answer is no. The answer cannot be no. Okay, even sometime when the supply is very, very short, we use the army, to send our PPE to the Sabah and Sarawak and to other remote areas. No is not the answer. Next. And what did we do? You can see this is the map of the state, maybe for our foreign guests from overseas. Every state, we have the map. You can see that we color the map according to the number of cases. We go down to not about whole Malaysia, we go to respective state. Not only to respective state, we go down to the district. Not only to the district, we go down to the sub-district, to the Mukim. And we do that. And we do very targeted one. This is what did we do. And we presented it to UK delegate when they came to Malaysia. Yeah. Next. And we monitored it daily. Not only that, we monitor the cluster. You can see that this is the cluster. This is the cluster Sivaganga, if I'm not mistaken. From the first case until the cluster Tawar. Cluster Benting, yeah? Yeah, cluster Benting. From the case, we trail down until we can trace everybody. So how did we do? We do active contact tracing and then we trace everyone, yeah? This is just an illustration. Next. And how about hospital operation? Currently, we have 5 types of hospital: state hospital, major special hospital, minor, district, and special institution. All these 5 we converted into, number 1, fully COVID, treat nothing else except COVID. Number 2, hybrid COVID, meaning treat both COVID and non-COVID. And number 3, only non-COVID. And number 4, we have low-risk quarantine center, as I mentioned to you earlier. We have the field hospital, we have makeshift hospital, we have IMAM hospital. Next. This is an example, makeshift hospital in Pokok Sena Detention Center. We convert the detention center and become a hospital. Next. And this is work together with other agencies. This is the field hospital in Tawau. The field hospital in Tawau, we work together with the armed forces. And this field hospital has OT, operation theatre, and can do operation and has ICU, and the capacity is 100 beds. So, and we did it less than 3 days. So after 3 days, we start doing the operation and so on. So our Tawau hospital focus on COVID cases, and field hospital in Tawau will supplement our hospital in managing non-COVID. Yeah, next. And this is what I'm trying to say, the procurement. You have to buy the thing you can see down there. Buying PPE, buying ventilator is no longer like those days. If you buy, you must buy like Agoda and Trivago. It is blinking. You must buy, and not only that, you must pay. This is not allowed. Buying any equipment must the item must come and arrive and you pay. But if you do that, the thing is blinking, other countries will buy. All over the world are looking for that ventilator. So we have to get the approval from the government. Buy as crisis. During crisis disaster, finally government allow. We buy that according to that. And you can see that down there, up there, helicopter. We have bought that using Agoda or Trivago style. But we cannot bring back the consignment. Why? Because all over the world, airline, there's no airline. So we have to send special aircraft from Malaysia and bring back the ventilator to Malaysia. In short, no is not the answer. No is not the answer. For all the population, for the rakyat of Malaysia, yeah, we take care of you. Next. And we have workforce. We hire all retired staff, and we also advertise all of them and to work with us, including those who are not able to get job out there. Next. And what did we do? we help mobilize. This is just an example. All hospital affected, for example, in Sabah, you can see that Sabah, Kedah, Pulau Pinang, Labuan, and other, we mobilize resources, we send to those states that has less cases, will send staff to states that really need cases. So we send staff, so we help each other. And this is not only doctors, include everybody. And you can see the scientific officer, specialist, medical officer, nurses, medical assistant, lab technology, and radiographer. Next. And in the medical resources, we work together, we get donation, and then not only that, even the patient designer also help us in giving us, donate the PPE and so on. Next. And strategic communication is very, very vital. Very, very vital. We do daily VC to inform to the public the actual situation and do not create panic and so on. Next. And this is again strategic communication. Our meeting with the King, with the Prime Minister. Next. And again here we meet with all other state head, the Menteri Besar, with the Chief Minister, regardless of their party, whether they are oppositions or they are government party, because COVID does not recognize whether you are government or you are opposition. Next. You can see that here we have strategic communication meeting every day. On your left hand side, we can see that Tan Sri DG with blue shirt and me with the different attire. You know why? It was during Hari Raya. So we have a video conference with all the state pengarah and all the pengarah hospital during Hari Raya. There is no such thing like leave. There is no such thing like cuti lah. No, there's no public holiday for us in combating COVID-19. Next. And this is managing fake news, also very important. Next. It is another one, strategic communication. All of you know that MySejahtera. So we use this MySejahtera and we capitalize that. This is using digital technology. We have MySejahtera, we have SIMCA. SIMCA stands for System Information of the Health Lab. Yeah? SIMCA stands for Lab Information System, and we also perform virtual platform. And the most important now is the MySejahtera. Next. And MySejahtera, you can see these are the features of MySejahtera. It will give you health assessment, information update, statistic, check-in profile, and so on. You can see that you can update your risk status, hotspot tracker, MyTrace, managing dependent, locate health screening facility, digital healthcare, additional resources, and FAQ. All that in MySejahtera. Please enter that. Please log into that. And see what happened now. Until today, total registration 24 million. And then you can see that it is really, basically, it is very, very good response. Yeah? Very good response. Next. And for all of you down there, particularly the healthcare workers, I mentioned to you earlier, no single healthcare worker get infection when they work in COVID ward. Meaning, COVID ward is the safest place for them to work. It is the safest place in the planet Earth. But how do they get the infection? Number one, you can see that they did not wear the mask while working. And then number two, they don't wash. Number three, they don't implement the physical distancing at least 1 meter. And then number four, they don't follow SOP when they are in the on-call room, in the pantry, in the prayer room. So number four is very important. Some of them, they didn't get treatment. When they get sick, they got infection from community. When they come to the hospital, they don't seek treatment. So these are four main sources of infection among healthcare workers. So next. So we must implement this 3C and 3S. I think all of you remember 3C, avoid crowded place, avoid close conversation, and then avoid confined places, and practice 3W, wash, warn, and wear. Yeah, wear, and then wash, and also warn. Next. And then this is very important. Yeah, this to wear, you must wear the mask properly, cover the whole thing. Not like the second column, you can see this person only cover the chin, only cover the chin, not covering the whole part. So good, eh? We can be sure that the second column, his chin will be protected from COVID. His chin will not get COVID, but the rest of his body will get COVID. Okay, next. It's very important. I told you that this is new norm. You can download it from the MOH portal. Yeah, you can download from the new portal. Next. And Ministry of Health, yeah, country healthcare custodian, leading with the patient and knowledge, and then we make decision based on evidence. We don't make decision based on rumors and so on, yeah. And then it is leading with patient, leading with knowledge, and then making decision with evidence. Next. And it is tribute to our healthcare workers who have been working non-stop, and then they also have families. You know, all of you remember some of your friends, the nurses and doctors, after they come back from office, from hospital, they're scared to go back home, They're scared to hug, to kiss their kid. Because, they might bring back the virus. So you can see, they work in tremendous stress. So this is what happened to our frontliners and as well as our backliners. Next. And I mentioned it again here, not only frontliners, also backliners. Yeah, frontliners is the army that go to the war, fight with the enemies. But this army will not be able to do so without backliners who prepare the data, prepare the strategy, prepare all things that needed by the frontliners. Therefore, in short, backliners and frontliners equally important in managing COVID. This is very, very important. Next. With that, ladies and gentlemen, that's all my presentations and my entertainments. Delima selasih, duku mengkudu. Terima kasih. Thank you. Love all of you.
Thank you, Dr. Rohaizat. Thank you so much for the informative, useful talk. Inshallah, we will now open for questioning, inshallah. I will read the first question that we got from some of our attendees. The first question is strategy for enrolling the vaccine or vaccination among the population, as not everybody can or may get it. What can we expect, Datuk?
For this question, strategy for enrolling vaccine among population, as not everyone will get it. So all focus is now in Malaysia is about to flatten the curve. The curve is going up, we have to flatten it. And the factors for consideration of vaccine for our country, among others, are number one, we need data. Data on safety, data on quality and efficacy, where the efficacy rate must be above 50 to 60%. That is number one. Number two, we need data on what are the population needed, who are they, and number three, how many vaccine, total doses that are required to achieve full immunity. Number four, of course, dollars and cents, the cost of the vaccine. And number five, very important, logistic of implementation, the vaccine program, including assurance of cold chains and other issues. In Malaysia, I think in Malay, I have concluded that we have to have five P's. P number one is pendaftaran, is registration. It's very important. The vaccine must be approved by the US FDA or by National NPRA of Malaysia, National Pharmaceutical Registration Authority of Malaysia. So this is number one, the first P. The second P is the pembekalan, the distribution, how to maintain the cold chain and what is the temperature like, because some vaccine they need minus 75 Celsius and then some of them need between 2 to 8 degrees Celsius. So if it is very, very low temperature, we need special device and we need special freezer. That will be costly. And then under the pembekalan, item number 2, second P, pembekalan means the distribution, we must also look at the issue on logistic. The third P is the pemberian. Who are the person required? The population covered. And in this one, we need to do it in phases. Maybe initial phase, we need to cover 20% of the population and focusing on the frontliners, healthcare workers, and all other frontliners, including the vulnerable group, those already immunocompromised, the elderly, and also people are bedridden and so on. That is the third P. And the fourth P, the pemantauan. pemantauan dan monitoring. We need to monitor the side effect, monitor the reactions, and the fifth P is the penilaian, evaluation. We need to evaluate the effectiveness and the safety of the vaccine. So in short, before we implement, you must consider a lot of things, and while implementing it, the 5P need to be in place.
Thank you, Datuk. We pray and we hope that everyone will be eligible will be able to get that vaccine. Okay, the second question, what lessons have we learned from dealing with this pandemic so that our future generations will be able to do better?
For the second question, just now you asked about lesson that we have learned from dealing with the pandemic, so future generation will do better. This is also quite difficult question, but I think there is no single ministry involved in managing this pandemic. This is very important. There is no single ministry that involved. It has to be whole society approach or whole of government approach. You can see like in Singapore, they implement whole society and whole government approach. Similarly, in Malaysia and other countries, this is very, very important. We need teamwork, and we need to have proper and stronger crisis preparedness for the country. Yeah, I repeat, proper and stronger crisis preparedness for the country. And the most important is we have to balance between the life and the livelihood. We have to balance the two, between the life and the livelihood, between the way we manage COVID and then the way that the economy and the industry will be affected. So these are very important. And another thing that it is needed, we have to have the flexible policy. Flexible policy, especially on the payment, especially on the purchasing of the item during crisis. If you can recall in my earlier presentations, when we purchase the PPE or ventilators, we cannot purchase like those days. The consignment, before the consignment come, we have to pay. It is like buying or booking the hotel using Agoda or Trivago. If you don't click, and then you will not get the equipment. So, in short, there must be ways for us to buy item, and then it must be flexible enough to handle during crisis. And another important thing is that data consolidation, and then for proper planning and decision making. And then data alone is not useful. But the most important is the ability of using data for management and decision making. Last and not least, whatever we have learned now, we must document, and then for future reference. We must publish, we must document and do research, innovation, and also, again, documentation for future use is very, very important.
Okay. Thank you, Datuk. So we hope that you, the younger generations that will follow the footsteps of Datuk Rohaizat, will be able to achieve better than what we have done in dealing with this pandemic. The third question, what will be the strategy? What is the strategy to enroll the marginalized community, to example the refugees, the undocumented, the migrants, the homeless, into this vaccination program?
The third question is about the strategy to enroll the marginalized community, for example, refugees, undocumented workers, migrants, and so on. And I think this is quite political, and we need to engage with NGOs and other international agencies like IMAM, IMARET, and so on. Because if you have noticed in Sabah and other states, whenever ministry try to help these undocumented migrant, local Malaysian are not happy. They said, why must we use the government taxpayer money to help the undocumented migrant, whereas there are many Malaysians are suffering. Therefore, we need to have other strategies via NGO, for example, IMAM and IMARET, as I mentioned earlier. And we have to collaborate with other ministries, we have to collaborate with other international organizations like UNHCR, and to address the marginalized community. For example, in some part of Sabah or even in Klang Valley, since the services is conducted by NGO, and the public accept it. Even in if you look at what happened in Cox's Bazar, local people in Cox's Bazar was not happy when the government tried to help the immigrant, tried to help the outsiders. But by having Cox's Bazar, the field hospital via NGO, not only the foreigners who come for treatment, local also come for treatment. So the role of NGOs in this managing marginalized community is very important. And we must use, for example, other agencies like Immigration Department to look at their status, Ministry of Human Resources via Act 446, looking at workers' minimum standard of housing and amenities, because some of them they might try to get cheap labor to increase their profit. So in short, managing the vulnerable group, managing marginalized group, we had to work together with other ministries, other agencies, particularly NGO, because NGO has a lot of strength, and we have to capitalize their strength for the benefit of this marginalized group. Thank you.
Thank you, Datuk. We really pray and we hope that we will be able to take care and vaccinate all of our marginalized communities. Inshallah, to that we have come to a close for this session. We thank Datuk Rohaizat so much for spending his time with us. We ask Allah to make him able to continue in his journey to help the community, and that he will succeed, insyaAllah, together with KKM to bring this pandemic to an end soon, insyaAllah. Again, thank you, Datuk. Assalamualaikum warahmatullahi ta'ala wabarakatuh.